ponder and try. It is not just for us, but for our families also. The young people in the family, the children, they can be cultivated the best of the habits that we may not be able to do now. But as doctor, as specialist, a lot of your family members and your community is looking up to you as the source of guidance for these common issues. Regardless of whether you are surgeon, physician, any branch, they come and ask you. The best way to live is to follow what your body is telling you, but until you know the language of your body, better follow these general principles. એટલે પેલું મને તો સારું લાગે એ પ્રમાણે હું કરું છું એ કરતા પહેલા you need to know the language. So one quiz, MCQ. What is the number one factor affecting health and longevity? Anybody can answer. MCQ. Sleep. Okay. Anybody else? Quickly. After about time, please. There is no negative marking here. You can throw the answers. Anyone? Exercise. Okay. Stress. Okay. So Amadati for stress will take it. Anybody else?
What to eat?
What to eat. Okay. All right. So we'll see what is the evidence. And so tobacco and longevity. Of course, it depends on the number of cigarettes or tobacco amount and all. But average reduction is about 10 years. So this is kind of a benchmark to understand how to compare. This is a very recent study, BMJ Open 2024. In this study, they have looked at 4 factors: gender, education level, marital status, and race. Out of this, gender and race you cannot change. Only 2 things are in your hand. And they found an 18-year difference in the longevity if you are having all 4 on the worst side versus all 4 on the best side. 18 years. The tobacco average was 10 years, this is 18 years. So, a more detail of this study is a cross-sectional analysis of a huge number of people and applies to between 30 to 90 years. Okay? But they did not study the details of these things, that as to how they affect and what may be the more important components from this. Harvard has been doing this study for about 75-80 years. So they have studied 3 generations of people, and initially they started with the very basic things. Now they have been doing MRI, specialized blood tests, molecular tests, etc. As the science is advancing for next generation, and now their grandchildren and their children are in this study, because when they started this study, everybody is no longer there. So what they found was that compared to anything else, relationships had the biggest impact on health and longevity. And they not just physical but even the brain function as well. And this, not only they have studied this retrospectively, but after the initial about 25-30 years, they studied prospectively. That means based on the factors, they predicted that who will, based on these factors, will live longer and healthy, so that the study is more robust. And that also they could predict well in majority of cases, based on relationship. Okay? What they said is that quality of relationship is more important rather than quantity. So obviously number of friends on social media do not matter here. feeling that you can count on that relationship in times of need was most important, even if there were daily fights between spouses. So for all the married people, this is a good news that even if we are having fights, it is still a very important relationship. So don't feel that fighting means relationship is gone mad. Socially connected people are healthier and live longer. The relationships could be family, friends, professional colleagues, community members, many different circles are possible. And there could be more than one circle. They also studied that those who made new friends after retirement fared better. So say for example, you are practicing in Palanpur, you retire and you move with your children to say Mumbai or US and you don't make any new friends, then your health goes down much faster. But those who made new friends there, made new circles, did well. So many levels they have studied, and there are so many papers on this. Maintaining relationship is a lifelong task, and this is where most people lose patience. Because somebody asked this professor, if this is so important, why people are not doing this? Because it's a lifelong task, and over time we lose patience. Family or friends, we create distance or so-called breakup. So that effort is very important. Why? There are a lot of theories about that, multiple papers. We will not go into detail. Brain, gut, microbiota, axis, neuroendocrine, immune pathways, inflammation reduction. That if you have good relationships, then the inflammatory injuries in the body will be much reduced, and that will lead to a healthier life. And of course, you will have a better healthy behavior, because if you are happy relationship, then when you have a stress, you are less likely to drink, smoke, eat bad, or do very long, not having good sleep at night. All those issues will become much less. As per their study, loneliness is the biggest killer. We don't realize this today too much, because in India this is not much of an issue, but the countries where this is an issue, they realize how important it is. So lifestyle is a very wide topic, so we will not go into the detail, don't worry. But when we talk about lifestyle, most of us only talk about what to eat and some exercise. But there are many phases of life, many points which need to be covered in the lifestyle, which is related to menstrual cycle, pregnancy, delivery, preconception, different weathers, at home, at work, and how we deal with bad news in our life or good news in our life. So coming to now several studies, I will go through these very quickly because no point going through the detail, but eat early and small frequent meals can reduce obesity as shown in this study, and all p-values are statistically significant. Okay? And eating the largest meal late is associated with more obesity for each additional hour. Same has been studied for diabetes also, that if you take your maximum calories like around 12 in the noon, that is the best. And after 7, every hour, the diabetes risk and obesity risk goes up. So 7 to 8, 8 to 9, they fed the people same food in different timings and studied their metabolic parameters. Dental hygiene and cancer. Now everybody may think that having a poor dental hygiene will lead to oral cancer. No, not just oral cancer, it is associated with cancer of breast, lung, esophagus, gallbladder, and even melanoma of skin. And this is a study of 65,000 women. These are not small studies. So why oral hygiene is so important? We should have a dentist in this group. They will be very thrilled. There are many studies also to suggest there is association of poor dental hygiene with heart attacks and even rheumatological diseases. Multiple antibiotics increase the risk of colorectal adenoma, and colon adenoma is a known precursor of colon cancer. Because when you take antibiotics frequently and long time, you alter the gut microbiota, and we have obviously gastroenterologists who would say that now there are several articles on gut microbiota, not just in GI field, in practically every field. The impact of gut microbiota on our health. Too much vitamins increase the risk of cancer. This is another important one for us and for our families and patients. That high dose vitamins have consistently been shown to be either no benefit or detrimental, but never beneficial. So this is very important. Lung cancer risk was increased from too much B6 and B12. In myeloproliferative disorder also we have potential collaboration of high B12 and MPNs. So high dose vitamins long term is a bad idea. Night shift increases risk of breast, GI, lung cancers in women. And this is again huge study. 39 lakh people being followed for years in Europe, North America, Asia and Australia. So none of these are small studies. Very strong evidence. Another study, night shift work a risk factor for breast cancer with an odds ratio of 2.61. That means compared to normal population who is not doing night shift, there is a 2.6 times higher risk of developing breast cancer. So this is a direct quote from the CDC USA, Center for Disease Control USA website. They don't say anything just like that without very strong evidence, right? They will not, because this will be taken up by US public as a very important authentication of a scientific manner. So when they say something, it is backed by a lot of data. And what they are saying, night shift seems to increase the risk for type 2 diabetes, heart disease, stroke, metabolic disorders, and sleep disorders. Also, reproductive issues such as irregular menstrual cycles, miscarriage, and preterm birth, digestive problems, and some psychological issues such as stress and depression. Like I said earlier, this whole long list of NCD is associated with many of the factors that are common with cancer, cardiovascular, and all these diseases. Now, how do they define this risk factor? The good thing is when these formal bodies get into, it's not just a general talk. So they have defined what this means. So when they study, they have to decide that what is night shift, how many hours of being awake from what time, etc. So night shift means at least 3 hours of being awake between 12 to 5 a.m. Yeah? So now we have to realize how many of our children, youngsters are awake 3 hours between this. How many of them are today sleeping at 12, 1, 2? This has become very common, right? So this is an important point. Frequent night work, 3 or more nights per week. Again, how many of our youngsters are awake 3 nights a week like this? Long term, 10 or more years. And beginning early in adulthood, before the age of 30. This is a recurring theme. Earlier, the more risk. This, our youngsters, become very common. Now, the physiology, why this may be happening. So what they are saying is that the circadian disruption can harm biologic systems that help prevent cancer. In addition to promoting sleep, melatonin can also stop tumor growth and protect against the spread of cancer cells. So the laboratory animals where their days and nights were disrupted had reduced melatonin and increased rates of cancer or tumor growth. So this has been shown in animals already. And melatonin is produced during sleep only between 10 p.m. to 2 a.m. That is why the ideal time for sleep has always been recommended earlier as before 10. What our grandparents were doing, as you go through this, all of you try to visualize throughout the talk your grandparents' lifestyle. And you will say that, એ તો બધું કરતા જ હતા, હવે તમે નવું શું કીધું? See, just at almost every point, you will be able to relate with what they were doing. So, because many children argue with us that you are saying 8 hours of sleep. So, હું 2 વાગે સુઈ જાઉં ને 10 વાગે ઉઠું છું. I'm getting 8 hours sleep. So, what is the problem? 12 વાગે સુઈ જાઉં 8 વાગે ઉઠું છું. I'm getting 8 hours sleep. But the sleep, when you get that sleep, is also important. Because just like melatonin, there are many other systems in the body also who work at a specific time. So, our liver, heart, every system has their own specified time when they do certain maintenance work. Okay? So if you are awake at that time or doing something, they will not get time to do the maintenance. On the other side, if you wake up early, sleep early, there is a reduced risk of breast cancer. That also is studied and published in British Medical Journal. We know that other risk factors for breast cancer, which we were taught even during fellowship, early menarche, late menopause, not having children, late first full-term pregnancy. The strongest prevention of breast cancer is by having the first child before the age of 20. Like I said, everything will not be practical. I put a disclaimer earlier, right? But this is something to know. More recently known risk factors are smoking and alcohol increase the risk of breast cancer, more so if it was done before the age of 30. So I think this we have already highlighted, that a woman's risk of breast cancer is determined primarily by her lifestyle before the age of 30. That means physical activity, children, and alcohol, tobacco, mainly those, and of course diet. Spicy foods reduce cancer, heart disease, lung disease. There's some good news for our existing lifestyle. It's not all bad, right? I hope everybody had a good spicy food. Sedentary behavior, TV viewing time. We are seeing a lot more of young cancer, just like you are seeing young heart attacks. And one of the factors is the sedentary lifestyle, the screen time. In this study of 89,000 women, if you are watching TV 7 hours a week, the risk is higher, and if 14 hours, it is 70% higher risk compared to those who are not watching that much TV. Okay? So these are significant, and when these studies started, mobile phones were not much of in use. So you should say that screen time probably rather than just TV. Adolescent exercise, we already saw this earlier. Physical activity patterns and mortality. This is the good news for people who cannot do everyday exercise. Because when we are talking about exercise, our belief is that it has to be at least 5 days a week, 45 minutes, vigorous exercise, all that. The good news for people like me and possibly some of you is that it doesn't have to be that much. Even if you are a weekend warrior, that means only Saturday, Sunday you do lot of physical activity, it is still almost as protective. So the highest level is from regular heavy exercise, not too much, but good 45 1 hour. Then little lower is this weekend bouts, and then there is about 4 to 5 minutes. There are other studies and not in this, but 4 to 5 minutes of bouts of activity. Say you take up the stairs, or you walk with the shopping bags of grocery from the mall to the parking. Here we have very short distance, but in US this could be a 5-minute walk. So even those little things, घरનું કામ કરું, household chores, these things also provide a reasonable protection, which is very important. Then dry fruit is helpful in reducing the risk of cancers. This was studied in colon cancer. After colon cancer, in reducing the risk. But the important line here is, because my patients sometimes argue that because it is so high in calorie, if I eat dry fruit, I will gain too much weight. So you read this line, that in this study and across the scientific literature in general, regular consumers of nuts, dry fruits, tend to be leaner, they tend to be thinner. So even though it is very high concentrated calories, but there are other substances that make you actually thin. So this is something to easily take home and do. Alcohol for women has double the risk of cancer. So if the men have X risk, for the same amount, women have 2x the risk. They have compared here with the cigarette level, so that if bottle of wine risk equivalent to 5 cigarettes, for women it is equivalent of 10 cigarettes. So no type of alcohol is safe. Even wine also has the risk of cancer. Light to moderate drinking linked to some cancers in women. Male smokers, I think will not go in much detail. So this, as I said, is not studied much in allopathy, but our thoughts do decide who, what we eat, who we eat with, how fast we eat. After stress ma hoye, so we are going to gulp it down. Okay? We will not have a better digestion. And of course the addictions. And it also decides our daily routine, our exercise, physical activity, so many things. So some of the biggest issues today, you can say these are also non-communicable diseases: depression, anxiety, loneliness, and they are related to this. And there is a complex interplay of the diet, activity. There are a lot of studies on diet and depression, that Mediterranean diet followed for I think about 12 weeks led to same depression reduction that happened with antidepressants. So equal magnitude reduction. So imagine that this is after established depression. If you are eating healthy diet all the time, that could prevent getting into depression. So that way it is. So there are many such things. Similarly, exercise and depression also, many studies are there that it reduces depression, and it will of course prevent. So in summary, I will quickly just go through the list, and you can kind of remember your grandparents and your family members to what take home points from this you can implement. This is not something to memorize, which we are used to as doctors. બધું મોડે કરી લેવાનું, પછી કેટલું કરવાનું ખબર નહીં. પણ even if one of these things we can implement, that would be very useful. In one line, because we have a lot of, when we get a cancer patient, the rest of the family will ask what lifestyle we can follow. and in OPD we don't have time to explain all these things. So one of the things I tell them is follow the grandparents' lifestyle as close as you can, because they are here, we are here. Even if we can get here, it is still a good achievement. Right, sir? So what my eldest uncle used to say, pair ko rakho garam, means stay physically active at home, taking stairs, whatever little things you can do, gardening, these, that. Don't, use vehicle, lift every day. So stay active. Pet ko rakho naram, that is obvious. And sir ko rakho thanda. So less of stress, less of do this, do that. Lots of things we want to do. We want to achieve so much in a short time. And we compare with other people that fellow has already got a Mercedes or a 4 BHK and or a bungalow, and he's been to so many foreign trips and so many things we compare. Or his OPD is very big. Doctors, numbers. So in summary, obesity is responsible for 40% of cancers in USA today, and depression and obesity have a both ways relation, very well studied. Okay? So depressed people more likely to get obesity, obese more likely to get depression. Gut microbiota, brain axis, we will not go into detail, but they control lot of our hormones, the gut microbiota, and hormones apart from other things have a big impact on the many cancers: breast cancer, ovarian cancer, endometrial and prostate. These are the big ones related to hormones. No amount of alcohol is safe, late to sleep and late to rise disrupts the biological clock. Only about 5 to 10% cancers are hereditary. Mental health focus. So learn and teach your children about how to handle stress, value of relationships and how to maintain them. Spirituality as source of strength and guidance, not just preventing issues but positive for mental health also. Yoga, meditation. So good mental health, as you can understand, is important for avoiding addictions as well as the willpower to implement healthy lifestyle. Clean mouth, so overall clean hygiene. We did not discuss this study where the hygiene of private parts has been clearly linked to ovarian cancer and endometrial cancer. Okay? HPV, we know, number one cause of cervix cancer. Good personal hygiene, we have discussed this. Physical activity, weekly television watching, reduce as much as you can. Avoid frequent use of antibiotics for simple ailments. No fixed prescription for all. Diet, we did not discuss about it, so in a nutshell, keep it simple, low variety, not too many varieties in a day. Remember our grandparents again, variety only during festivals and marriages. Other than that, same menu every day. આપણે તો તરત 3 દિવસ પહેલા જ ખાધું, ગયા અઠવાડિયે જ ખાધું. So low sugar, low salt, less fried, no or little processed food. Ultra processed foods have been linked to many cancers and cardiovascular and other diseases. So raw foods are better, home cooked foods better, daily dry fruits, whole fruit, not fruit juice. Now plenty of studies, because the fiber is very important. So instead of the fruit juice, which we all thought for many years that it is healthy, and savarna breakfast having a juice was considered good and sign of prosperity also for many people. Savarna hame fresh juice pine nikaliye chhe. So yes, it is good, but if you can have whole fruit, it is significantly better than the juice. Okay? Reduce serving size, पैकेज फूड्स જે આપણે વાત કરી અલ્ટ્રા પ્રોસેસ ફૂડ્સ અવોઇડ prevention efforts start from childhood, very very important. Encourage outdoor sports and other healthy habits. In short, lifestyle of our grandparents was close to ideal, including very good social connect they had, religion, spirituality little bit, content, early to bed, early to rise, physically active, simple diet, how to eat before sunset, adequate sleep, and they did not work on Sundays. Thank you. I think this is the same.